Hi, I'm Dr. Tanya. I'm from AM10 Medical. Today is really important and very special day for us because we are right middle of a lot of uncertainties. There are so many questions in our mind, and we are here at Primary Healthcare Network office, and we're talking to the man, the expert himself, who's rolling out the program in the Gold Coast. So I'm going to let Dr. Devitt to introduce himself because he's got a lot of titles and a lot of responsibilities. Dr. Devitt, can you please start by letting us know what you do and your titles and your job?
Hi Tanya, good day ladies and gentlemen, and thank you for this privilege to spend a little bit of time with you. For the last year or so, it's been my privilege to work as the clinical lead that coordinates and liaises between our hospital and health services and primary care, including general practice. And it has all been about our response to COVID, and of course now the implementation of our COVID vaccination program in Queensland.
Fantastic. We are really at that stage where the program is rolling out. What are the vaccinations that's going to be available, and when is it going to be available for general practice?
Tanya, after waiting now for several weeks, I can confirm that in 4 days from now, the first COVID vaccines will be given in Queensland, and they will be given here right in the Gold Coast.
That is certainly really exciting, very exciting. And what are the type of vaccination that's available?
So there are two different vaccines, and we will talk a little bit about the differences and who and where they're from. But for now, it's important to know that there is a Pfizer vaccine, and that is the vaccine that we are receiving first.
Fantastic.
The Pfizer vaccine can only be given in what is called a Pfizer hub, which is a hospital. And that's not because it's unsafe or special, it's simply because it needs very deep freezing to allow it to stay safe until we inject it. And that vaccine will be given from Monday next week. The other vaccine, which we will be getting in large supplies, is the AstraZeneca vaccine. And that vaccine will be arriving, if all goes according to plan, towards the end of March.
Fantastic. Who are eligible to get either of the vaccination? Is there any special groups who can get Pfizer or AstraZeneca?
That's a great question. And up to now in the media, we have heard about the Pfizer, and then we hear about nursing homes and vulnerable people. In reality, the term that we would like to use is vaccine agnostic. Because the two vaccines are both safe and both effective, what we are saying is that people will be getting the vaccine that is available. So whether you are in a nursing home, whether you are working in hotel quarantine, and thank you for those of you doing that, whether you're working in a hospital or simply going about your business, living in Queensland, you will either receive a Pfizer or an AstraZeneca vaccine.
So
initially, because the first vaccines are Pfizer and because they're reserved for the most vulnerable and the priority groups, it is true that initially it will be the Pfizer vaccine.
So it's not really because of one is more effective than the other?
Absolutely not. It is simply a matter which one came first.
Are they safe? Is there any difference in the safety between the two vaccinations?
Both vaccines have now been trialed for months, and we have the peer-reviewed evidence, but we also have the real-life experience from countries like Israel, Europe, the US, and abroad, and that has shown us that these vaccines are incredibly safe.
Because this vaccination had to be developed so quickly at great amount of speed, is it? Some people do worry about the safety of it. It's been steps being forgotten or not forgotten, step being fast-tracked. Is that true?
Tanya, people have the right to be concerned, and they should ask this question. Our Therapeutic Goods of Australia, the TGA approval, hinges on careful scrutiny of the evidence, and I can reassure all of you listening that not a single step was missed and every box was ticked. The reason we managed to achieve the successful development of a vaccine is because of incredible hard work from a large group of committed people And it is because of collaboration. The analogy that I use is preparing a meal in your kitchen. If you have only one cook, it will take that cook much longer to prepare the meal than if you have several cooks working together, each doing a different part of the dish and putting it together to enjoy.
That's absolutely fantastic way that you've explained that. The other question that I have in mind about the side effects, is there anything that people need to be concerned about, the side effects?
Thankfully, serious side effects are incredibly rare. And in almost every instant, they can be successfully managed by your GP or clinician or provider. If we think about Queensland, the latest evidence suggests that the chance of an anaphylactic type reaction within the first few minutes after your vaccine is only 1 in several 100,000. Now, the reality is that a lot of people, as many as 1 in 10, might have very minor symptoms, and they're usually self-limiting. And what I like to remind patients about is that those minor symptoms are usually just an indication that your immune system is working really well. It is responding to something strange, and those symptoms is your immune system's way to let you know that it is dealing with this vaccine that has been introduced to your body.
That is amazing. That's exactly what we want. We want it to
Exactly.
work. So how far apart the vaccination being given here?
Yes. So with these vaccines, the interval between the first dose and the final dose was set to a minimum number of weeks to help with the research and the development.
Right.
So the minimum period of time between vaccines would be, in the case of Pfizer, 3 weeks, 21 days, and in the case of the AstraZeneca vaccine, the minimum period between the first and the second dose is 4 weeks. But in fact, we are now, based on international evidence, making the recommendation that for the AstraZeneca vaccine, which will be the one that is used most commonly, we are now in fact recommending that people wait 12 weeks between the first and the second dose.
That is a really very good information, because I haven't thought it was 12 weeks apart. What if someone misses a dose
Yeah.
of the second vaccination? Is there any concern? What should we do?
Yeah. As soon as someone realizes that they may have missed, and of course life happens, then they should just have it as soon as possible after that point in time.
Okay. And are there any particular groups who shouldn't get vaccinated?
So currently, the Pfizer vaccine is approved for every Queenslander over the age of 16, and the AstraZeneca is approved for all Queenslanders over the age of 18. So the first answer to the question is that children and adolescents are not routinely included in the vaccination process. The other group is those that might be COVID hesitant, and no one in Queensland have to have the vaccine. It is mandatory. And then there is that group of people right at the end of life that might be very frail, and they might have really serious medical conditions. And there it is necessary for the patient, the carers, the GP or clinician of choice, just to consider whether it is in their best interest to have the vaccine. But they would have done that anyway for any other intervention to make sure it was suitable for them.
Absolutely. How soon will the immunity set in once vaccinated?
So we're still researching that, but our best evidence suggests it takes about 2 weeks. However, we know that even when you are immune or should be immune, that people can still contract any other illness, and we would stress to you that it is important to continue social distancing, the basic hygienic precautions that we've now been taking some time to just make part of our normal life, and to remember that even though you may be immune against one illness, you could still contract other illnesses.
Absolutely. That's really very important thing that you mentioned. Just because someone is vaccinated, it doesn't mean that they can do whatever they want, but we have to still follow the safety precautions, because there could be other illnesses around
Correct.
as well, right? So that's very important that we should all be considering, follow the guidelines, follow the instructions from health authorities, and we all need to stay safe and stay healthy. Is there anything else you would like to add that we can communicate to our people?
Tanya, I think there will be people listening to your show that may be at this stage thinking about starting a family. There might be some of the viewers that's already pregnant, and they will have questions about what the COVID vaccine means for their reproductive health. Now, because of the nature of research, we would not go and study new vaccines on potentially vulnerable groups. And because we don't start with children and pregnant women, we don't have any information initially. Currently, there is no evidence to suggest that it is a problem. Unfortunately, it's very difficult to make a firm recommendation either way. And I suspect it will be a matter for each of your listeners to really consider in their own life how they think about risk, what is right for them. And I would advise them to discuss that with their GP or clinician of choice to make a decision that is right for them.
Absolutely. Before we conclude, I did have one question in my mind that suddenly popped. Say if someone is returning from another country and have vaccinated over there, and they've got the certification that they have vaccinated, does that exempt them from quarantine?
That's a great question. For those travelers coming back, they will be under exactly the same health directions as every other traveler. One of the reasons we've been so successful in Queensland and the wider Australia is because we have clear directions that outline what is expected of returning travelers, and they will apply to everyone.
And same applies to someone who's got vaccinated, the 2 doses, and traveling abroad. So the rules of their country
will apply. Correct. And we would advise any listener that before you travel, that you make really sure that you understand the requirements of each country, which might be different. But also, given with the type of year all of us had, is just to prepare for uncertainty.
Absolutely. Thank you so much for spending this time with us, and thank you so much for watching. I hope we are able to solve a lot of questions and queries that you may have had. If there's anything more that you want us to inquire or talk about or discuss, please feel free to contact us. You have Facebook or email. We are happy to help, happy to talk to you. If not, we are happy to answer your questions. 1300 for AMTAN at any time. Stay safe, stay healthy.
Thank you, ladies and gentlemen. Thank you, Tanya, and best wishes for everyone.